Hi Kevin, my name is Kaylee Witt, and for my internship I worked as a physical therapy aide at the Therapeutic Associates Physical Therapy Clinic off of State Street. So as an aide, I had a lot of duties, but primarily I worked with the patients through their home exercise programs as well as their exercises after having their first 30 minutes with the PT for scraping or dry needling or any other treatment. So with that, I worked with a lot of various patients, but I primarily focused or worked a lot more with those coming into the clinic with lower extremity injuries or problems that they were seeking treatment for. And for my internship, I specifically focused on those coming in with Achilles tendinopathy. So for Achilles tendinopathy, this covers any problem with the tendon, like tendinitis, tendinosis, any inflammation or tendon tears. And there were a various amount of PTs that used different tactics for treating this diagnostic category, but of them was dry needling, and I was very blown away with the benefits and the process of dry needling, as I had never seen it before. So that's how I came about my project. So the hopeful impact of this project is to support the usefulness and benefits of dry needling in treatment plans for patients experiencing Achilles tendinopathy. Specifically, I learned that dry needling has great benefits in activating the healing process. It is done by inserting a solid filament needle into either muscle or tendon or whatever is being injured. So in this case, it was for Achilles tendinopathy. But majority of the PTs would use 30 by 40 or 30 by 60 millimeter needles and insert them in. Two of them were inserted into both of the gastroc heads, and one was inserted into the soleus. And then these would also get some electrical stimulation for a couple minutes. But the whole purpose of this was to reduce the inflammation, reduce the pain, and kind of lead to a further or more activated healing. So from my past coursework, I have been able to utilize the knowledge I've gained from applied anatomy, medical terminology, as well as physical activity for special populations with this project, as I was able to use key terms that I've learned, as well as the various body muscles and regions to be able to further understand dry needling and specifically Achilles tendinopathy and the effect it has on not only the Achilles but also the gastroc muscles as well as the soleus. So for the methods, I observed and scribed in a lot of PT evaluations. I observed Dr. Cole Davis, my internship supervisor. He dry needled a lot of Achilles tendinopathy patients. I was able to receive dry needling firsthand, and I was able to remove needles from patients, and I worked through a lot of exercises with these patients as well. The results revealed decreased pain, improved range of motion, increased muscular function, and reduced stress of the Achilles tendon. Dry needling is primarily beneficial in the early stages of the tendinopathy rehabilitation, as it is not a long-term treatment or something to really depend on long-term. The long-term aspect would be seen in the home exercise programs and the usefulness of these that the patients use when they are outside of PT or they are no longer attending PT. So the whole hope is that the dry needling is used to relieve some of that pain in hopes of them pursuing and continuing their exercises to further their treatment and see it more long term. But for future directions for the project, more diverse research behind the overall effect of dry needling and its usefulness in treatment plans for various tendon injuries should be sought after. And for my personal directions, in my education, it has allowed me to grow in my understanding of Achilles injuries and treatments related to their rehabilitation. And pertaining to my future career as a hopeful PT, this project is relevant because it has taught me a lot of what I will be learning in my PT program, and allows me to have a more in-depth understanding of dry needling, specifically the methods, uses, and effects it has on other patient care.